in collaboration with Dr. Rela Institute and Medical Center. I invite our Medical Director, Dr. Bala Subramaniam, to deliver the welcome address.
Let me first of all wish you all a very happy 2021. I have great pleasure and it's indeed my privilege to welcome all of you for this press meet in connection with the first successful bone marrow transplantation. Chairman and Director of the Rela Institute and Medical Center for this unique event. And also welcome Mr. Chandra Mohan, our Chief Executive Officer of Kanchi Kamakoti Children's Hospital. Of course, the hero of the day is our pediatric hemato-oncologist, Dr. Deena Dayalan, who is a consultant in our institution as well as in Rela Institute. Welcome, Dr. Deena Dayalan. Along with him, we have Texas Hospital, Dr. Naresh Shanmugam, my good friend, the pediatric hepatologist of Rela Institute, who has been the channel link between Rela and KKCTH in getting this on. And I welcome all the consultants of
I want to thank Dr. Deen Dayal for giving me the background to the story. I think it's very important for you to understand that. And I want to thank Dr. Bala Subramaniam for organizing this and keeping me updated. We were meant to meet 2-3 years ago. And I want to thank Dr. Chandra Mohan as well, the CEO, for organizing this. Now, the association we have between our institution and the Child Trust is a long-standing one, and I think I visited here some 15 years ago when I was working in King's and gave a lecture here on liver diseases, and I was amazed. At that time I didn't realize that there was such a big hospital, and you said that COVID time has been a tough time. Today I walk into this institution, it's just teeming with patients. I felt that, when I was approached for supporting the bone marrow transplant program, it's a very important aspect for us as well to have an association with a hospital like this. In the Child Trust special it's a low cost but very high-end treatment options. I think everybody who works here, Dr. Bala and the most highly specialized intensive care, Dr. Priya is managing liver children cancer for free for many patients. I think to have an association for an institution like this and not a corporate hospital and to provide such a high-end care for patients is very important for everybody to support. And I want to thank Naresh really for being the link really for us. I mean, he's a pediatric hepatologist and he's probably responsible for the smooth running and this association, what this association provides. I mean, we are a corporate hospital, and you know that the cost can be very, very low and very, very effective in institutions like this. Even for us to do a bone marrow transplant, and when they don't have a funding, when a corporate hospital is approaching for funding, it's very difficult to get funding. Whereas a trust hospital like this approaches for funding, it's very easy to get funding. And this is something with a cost of almost 9 to 10 lakhs, isn't it, for a cost of bone marrow transplant. And when we can share the doctors and and also the infrastructure and everything, then the cost comes down, because we have Dr. Deena Dayal, the whole team here to manage these patients, and when we can share it between 2 or 3 institutions, obviously the cost is much lower. And I think that has been a huge advantage for us, and we are very delighted. And what's most important is this is not an operation like other transplants. You saw what Dr. Deena Dayal said. Even then, I think it's very difficult to get good outcome in bone marrow transplant, because it depends on the infrastructure. It depends on how well these children can be protected from infection complications. and then discharged and very carefully managed immunosuppression for over a period of time. You shouldn't think bone marrow transplant is just like a blood transfusion and what's the big fuss is about. It is about actually looking after these children, and that's why the nurses and the doctors and the health professionals and the infrastructure available is important. And I'm so glad that the first two cases have been so successful here. And I think your role as the media is to make people understand. That is why you're here, that such services are available in trust hospitals at a very cost-effective manner. And not just cost-effective, but extremely successful manner it can be done here. And thank you all for coming. And I thank the team here for asking me to be present here. I think it's a very important moment, even for the childless history. You've been here serving how many children? How many thousands and thousands of children's lives have been saved? And you said there are about 10,000 children in Tamil Nadu who require bone marrow transplantation. And I don't think we can leave these children to have transfusion again and again with all the complications of transfusion. And I think it is very important that we provide a good opportunity for these children, not just to live, but to have a good quality life. I mean, the striking difference between a child who did not have a bone marrow transplant and managed without a bone marrow transplant and the one who had bone marrow transplant, you see for yourself. And this technique really improves the quality of life for the child, for the family, and for everybody tremendously, and allows them to have a normal life expectancy. And thank you very much for coming here, and I thank the team for inviting me for a celebration of this. Thank you.
Hospital is not another children's hospital in the city. It is very different. It is unique in many ways. Now our focus is of course on healthcare, but also we are one of the biggest educational institutions in the country. We produce about 21 postgraduates every year under the auspices of the National Board, and also about 12 fellows of supersessional institutions. We have also been adjudged as one of the best teaching institutions in the country by the National Board. Apart from providing education, we also do research through a research foundation called the Child's Trust Medical Research Foundation, CTMRF, which is one among the 3 institutions recognized by the Department of Science and Technology. Every year we produce a lot of research papers which are published in leading medical journals. Secondly, we are a not-for-profit organization. Our objective is not to make profit. Whatever hospital income comes, that goes for the expenditure. And finally, most importantly, I must say that every year we spend about 4 to 5 crores for free and concessional treatment for poor children. We source it from our own kitty, plus donors, NGOs, and crowdfunding events. I must say that there are 2 annual events which we are very proud of. One is the free surgery camp for poor children. Every year we cover about 60 children at a cost of about 75 lakhs, doing various kinds of surgeries, starting from cardiothoracic to ENT, everything we do it at free of cost. And post surgery treatment is also provided at free of cost. Second,
one is white blood cells, and third one is a platelets. And red blood cells, thalassemia majors, genetic conditions affecting the red blood cells. And red blood cells contain the hemoglobin that carries oxygen all over the body. It's like hemoglobin that causes thalassemia. So this, when you have a low hemoglobin, we call it anemia. What is the prevalence of thalassemia in our country? It varies anywhere between 1% up to 19%, depends upon the ethnic group. Actually, in Haryana, Punjab, almost like 10 to 15%. Okay. Now, how many thalassemia born per year in India? Any idea? So, like almost 10,000 thalassemias are born in every year in India. Or that means 1 thalassemia born every hour. And India has got 1 lakh thalassemia major patients. Almost India got 42 million thalassemia carriers. What do you mean carrier? Carrier means They have the disease, but they don't present the symptoms.
நான் ரொம்ப ஏழ்மையான குடும்பத்துலேருந்து பிறந்தவன். என்னோட குழந்தைக்கு இந்த மாதிரி ஒரு பிரச்சனை இருக்குன்னு தெரிஞ்சும் போது நான் ரொம்ப ஃபீல் பண்ணேன். அதுக்கப்புறம் சார் தீனதயாள் சார் தான் ரொம்ப என்கரேஜ் பண்ணாரு. அதெல்லாம் ஒன்றும் பிரச்சனை இல்லை, நீங்கள் வாங்க பார்த்துக்கலாம் அப்படின்னு சொன்னார். அவர் சொன்ன ஒரு வார்த்தையும் இப்போதைக்கு எனக்கு மனசில் இருந்துகிட்டே இருக்கு. அதுக்கப்புறம் எப்படி இதெல்லாம் சர்ஜரி பண்ணோன்னு சொல்லிட்டு ஸ்டெப் பை ஸ்டெப்பாக சார் சொன்னார். ரொம்ப பயப்பட வேண்டிய பிரச்சனை இல்லை, இதெல்லாம் தம்பி நீங்கள் வாங்க நான் பார்த்துக்கிறேன்னு சொன்னார். அவர் சொன்ன வார்த்தைனால இப்போ வந்து இந்த இடத்துல நான் நின்று பேசிகிட்டு இருக்கேன். என்னோட குழந்தை வந்து நான் ஃபர்ஸ்ட் பிறக்கும்போது நான் முதல் பிறவோட பிறந்தாங்க. அதை நான் ரொம்ப ஃபீல் பண்ணேன். அதெல்லாம் ஒன்றும் இல்லை தம்பி, நீங்கள் வாங்க நான் பண்ணித்தரேன்னு சொல்லிட்டு இப்போ என்னோட குழந்தைய முழுமையாக என்கிட்ட கொடுத்துருக்காரு. அவருக்கு மிக்க மிக்க நன்றி. மீனா மேடம் பற்றி சொன்னோன்னா என் குழந்தை என்னை விட அவங்க தான் ரொம்ப அக்கறையாக பார்த்துட்டு இருக்காங்க. அவங்களுக்கு மிக்க மிக்க நன்றி. அதுக்கப்புறம் சார் சந்தோஷ் சார் அவரும் ரொம்ப ஹெல்ப் பண்ணியிருக்காரு. இந்த ஹாஸ்பிட்டலுக்கு நான் ரொம்ப கடமைப்பட்டிருக்கேன். என் வாழ்நாள் ஃபுல்லாக இந்த ஹாஸ்பிட்டலை நான் மறக்க மாட்டேன். அதுவும் இல்லாமல் ₹1 செலவு இல்லாமல் எனக்கு சர்ஜரி பண்ணி கொடுத்துருக்காங்கன்னா ரொம்ப பெரிய விஷயம் அது. எனக்கு என்ன பேசுறதுன்னு ஒன்றுமே புரியல. கடவுளை நான் நேராக பார்ப்பேன்னு தெரியல, ஆனால் டாக்டர்ஸ் மூலமாக நான் பார்த்துட்டேன். ரொம்ப ரொம்ப மகிழ்ச்சியாக இருக்குது. இதுக்கப்புறம் பேசினா நான் அழுதுருவேன். ரொம்ப நன்றி.
I have 2 children, sir. One children is Asha Kumar and one children is Aditya Kumar. He is suffering from thalassemia from 6 months, and we are suffering a lot. We are coming. సప్తా ఫౌండేషన్ ద్వారా ఇక్కడికి రావడం జరిగింది. తర్వాత దీనదయాళ్ డాక్టర్ గారు, మీనా మేడం గారు ఇక్కడ మాకుండి ప్రతిదీ కూడా అండ్ ఎవ్రీథింగ్ ఇన్ ఫైనాన్షియల్ అండ్ మెడికల్ అండ్ సపోర్టెడ్ టు Kamakoti Child Trust Hospital and Rela Hospital. Ashar Kumar stem cells Rela Hospital ఇచ్చి ఉన్నారు. అండ్ ఇక్కడ హెల్ప్ చేసిన ప్రతి ఒక్కరికి BMT స్టాఫ్ ఆర్ క్యాంటీన్ స్టాఫ్ ఆర్ మెడికల్ అండ్ ఫైనాన్షియల్లీ సపోర్టెడ్ టు ఇన్ ఎంటైర్ మై ఫ్యామిలీ. థ్యాంక్ యూ వన్ అండ్ ఆల్. అండ్ సంతోష్ కుమార్ అండ్ సర్వెంట్స్ ఆర్ అండ్ సపోర్టెడ్ మీ అండ్ ఎవ్రీథింగ్ ఇన్ వన్ అండ్ ఓన్లీ 1/2 అండ్ ఎవ్రీథింగ్ బ్లడ్ టెస్ట్ ఆర్ ఎక్స్రే ఆర్ సంథింగ్ అన్ని చేయించారు. అందరికీ హృదయపూర్వక ధన్యవాదాలు తెలియజేసుకుంటున్నాను. ముఖ్యంగా దీనదయాళ్ డాక్టర్ గారికి అలాగే మీనా మేడం గారికి హృదయపూర్వక ధన్యవాదాలు తెలియజేసుకుంటూ సెలవు తీసుకుంటాను.